Welcome to Let's Talk Pain. I'm Carol Martin. I'm joined by Melanie Thernstrom, who is an author and has herself battled pain and has written about the subject for the New York Times. Also with us is Dr. Roberta Lee. She's a leader in the field of integrative medicine. We're so glad you're both with us today for the discussion. Thank you. I'm going to talk about their backgrounds a bit more in a moment, but first we'd like to speak a bit about pain and how important this issue is. Most people probably are not aware that 57% of adults in the United States have experienced chronic or recurrent pain. If you haven't experienced chronic pain yourself, there's a pretty good chance that a family member or a close friend of yours has. Now, Let's Talk Pain is not only the name of this program. First and foremost, this is a coalition whose mission is to increase awareness of pain and how it's treated. Through Let's Talk Pain, we want to encourage people and their healthcare professionals to talk about pain, to listen actively to one another, and also to take action that could improve care for those who have to live with pain. And hopefully, we can open up a conversation around this very sensitive topic. Now, today's panel is going to discuss integrative pain management, what that really means, and how an integrative approach to dealing with pain can offer patients a broader range of treatment choices. Now, a bit more about the background of our guest today. First, Melanie Thernstrom. She is a best-selling author and contributing writer for the New York Times Magazine. She has written about her own experiences, about 12 years worth of them with chronic pain, for the New York Times. She's also currently working on a book entitled The Book of Pain. Want to hear more about that. Thanks for being with us, Melanie.
Thank you.
Also with us is Dr. Roberta Lee. She is the Vice Chairman of the Department of Integrative Medicine at Beth Israel Medical Center in New York, one of the first departments of integrative medicine in an academic medical center. She has also recently completed a 7-year term as medical director at Beth Israel's Center for Health and Healing. It happens to be also a national model for integrative care, so we're so glad you can help us understand all of this, Dr. Lee. Yes. Which brings us to the first question, I think. What exactly is integrative medicine as you know it?
Well, it's the fusion of the best medical care between conventional things that we know of and those that we term alternative, although they're not really alternative. They're indigenous or traditional things that we might be familiar with, like acupuncture, osteopathy. And what we're trying to do is bring the approach into a preventive perspective. In other words, we're going to maximize lifestyle management and the body's capacity to heal first. Then we're going to bring in the things that we need to, one by one, to see what really improves the condition. In this case, it's pain.
Okay, give me a for instance, if you don't mind. Like, say if it's acupuncture, you said you're going to bring you through it. That sounds expensive and or time consuming.
It's not. For instance, let's just say you might have an inflammatory arthritis, rheumatoid arthritis. Okay. What we do first is look at your diet and ask, are there any things that that person is consuming that might increase inflammation? And can we add spices like turmeric or ginger that could decrease inflammation? Can we add fish oils? Can we increase the use of certain kinds of fish to reduce inflammation? We would look at stress. Is that person chronically stressed? We know that chronic stress increases inflammation. And do they need a medication? It could be they need a conventional medication. We'll bring that in too. And the total picture will be that that person's daily life will be improved far beyond the expectations of what we would normally have with just a medication.
Melanie, I think it probably sounds familiar to you, these approaches. Can you give us a synopsis too of how your pain battle has began and is at what point it is now?
Very familiar. I have a type of arthritis and it's been symptomatic for 12 years. And when I first got it, I had the model in my head that medical problems should be cured because all of my experience was, you know, you have a cough, you go to your doctor, you get a prescription for antibiotics, you're cured. And so I kept seeing different doctors and they would talk about treatment and management and reducing your pain to a manageable level. And I would think, well, you're not the doctor for me. I'm looking for the cure option. You're giving me the treatment option. That's not my kind of thing at all. And then, you know, finally the 8th doctor, I realized, oh, I guess there really isn't a cure. And I began to look at the idea of managing pain, and the idea that chronic pain is, a chronic disease. But if you can bring it to a manageable level, that makes all the difference between being able to have a good life and not. I think everyone can cope with some daily pain, just the same way you can cope with being, hungry or being cold or some other, physically adversive thing. But when pain crosses a certain threshold, it begins to dominate your consciousness and you can't do anything else. And then you can't think about anything else. And then you're miserable. And so what I find is just by focusing on treatments that reduce my pain, even say by 30% can make the difference between being happy and being unhappy.
That's a big realization, I imagine, the deciding the treatment cure. Maybe the cure word isn't going to work right now, or is that, am I?
And in some way, if you're too focused on a cure, then you cheat yourself of treatments that really would help, because you're busy going from like one treatment to another thinking, oh, maybe surgery, maybe acupuncture, maybe this and
you're
that.
on a chase for something that maybe is not really available ever.
When in fact, if you do 10 things and they each reduce your pain by 5%, incrementally, that's 50% pain reduction. Like once you accept that treatments, the benefit is often modest, but modest benefits can add up.
Yes.
Then you're much better off. Whereas I was looking, like most people, for that major benefit, which I think is what rushes people into surgery often, because they think, that will be a major benefit.
Well, they don't want to be, any of us in pain don't want to be defined by the pain. We spoke about that, Dr. Lee. It's like, first, one question before that: holistic, complementary, integrative. You hear these words tossed around. Is there a difference?
There absolutely is a difference. One of the things that happens when you use alternative or complementary is you tend to assume that there's no room at the table for using conventional things that we would normally think of as being part of everyday medicine. In integrative medicine, in holistic medicine, you can use both. So I think that gives us a lot of options, and that's what we're really interested in when we have pain. In other words, a medication, a conventional medication, is just equally as valid as being considered for that person with pain as acupuncture, because everybody's going to be different in the way they experience pain and the way they respond.
I see, and you never know until, so you're adding in, it's like value added really, the way Melanie was describing her experience, I suppose, as well. But that whole mindset, then the mindset has to change.
The mindset is really important.
A big piece of it, yeah.
One of the things that I love about integrative medicine is that we're looking at the whole person. You are not just your diagnosis of pain. You are a thinking human being with friends, with goals, with dreams, and we want to keep putting those things on the table to consider even when we're feeling pain. Sometimes when we're feeling pain, with your integrative doctor, you're going to discuss what are the things you can do now with the pain that are still moving you forward in your dreams, keeping you connected to your friends and your family. These are important elements to keep the quality of life up.
Yes, keep the quality. But Melanie, I'm wondering, when you talk about, again, changing the impression you have of yourself as a pain patient, adding in these little things, when did you know you were on the right track by doing that? As you said, you didn't want to be someone who was going for the big moment of cure.
Right.
Right.
How
did you know you were on the right path?
Right. Well, I think both, you have to be patient and you have to realize that modest benefits add up.
The patient, again, then the pain assessment process, it's different for everyone too, right? But do you have actual tools in your assessment process?
Oh, absolutely.
Yeah.
We're doctors. We have to have tools. We're medical scientists. We need to benchmark. So we have rating scales that are used in conventional medicine. Because we're integrative medicine, we're the fusion of both.